Hi, this is Lives Touched by Pets, a show for those who love and are loved by pets. I'm your host, Lisa DeSatnik, a certified trainer with so much potential in Cincinnati, Ohio. I am so glad that you're here. Welcome. As part of my own dog training, I work on a lot of behavior cases, pets experiencing big emotions that result in fears, anxiety, distance-increasing behaviors. With these, I may collaborate with my client's veterinarian or refer to a veterinary behaviorist. So educating pet parents about the value of including a veterinary behaviorist in our support plan is really important to me. Today, I'm thrilled to have with me a veterinary behaviorist to whom I have referred clients. Dr. Jill Sackman is respected internationally. She's a board-certified diplomate of the American College of Veterinary Behaviors and a board-certified diplomate of the American College of Veterinary Surgeons. She's the owner of Animal Behavior Consultants of Michigan. You are going to learn a lot today. This is a great discussion. Jill, this is so great to see you today. I'm really glad that we're here talking about this. So many people can benefit, and I think there's such a misunderstanding and lack of knowledge about what a veterinary behaviorist is and how people can benefit from that. So I'm hoping this is going to be super helpful for a whole lot of people out there. So I appreciate you taking the time to talk today.
Lisa, I'm delighted to be here. It's really exciting to have the opportunity to work with folks like yourself who are so in tune to behavioral challenges that pets have and pets in certain family and situations have. And many times, families, pet caretakers just don't know where to go to get help, or they may be completely overwhelmed with what's on the internet, and they don't know how to sort through what's important, what's not important. So hopefully we can cover some of those things today.
Speaking of internet, there's so much out there, and I can see that can be very confusing to a lot of people.
I hear fairly frequently when I'm meeting with the new clients that they don't know where to go for information. They've often done research, but it may have been research that it's taken them down the wrong pathway and is conflicting information. And then, of course, friends and family weigh in on what's worked for them, and they come in just completely overwhelmed on what to think,
right,
what to do, what to believe.
Yeah, and so often when I'm working on a behavior case, there is some sort of a medical issue going on, an underlying current that it can be addressed and that can really help with the process. So it's so important.
I think it is an area that it's time to really highlight, I guess I would say, is that pain, medical disability, not feeling well from a gastrointestinal problem, a dermatologic problem, skin infection, irritation, neurologic or orthopedic problems are incredibly important in both behavior change. So if I see a behavior that's been stable in a dog suddenly increase, that's where I'm going. Or if I see a dog who has had no other signs of anxiety or fear suddenly not wanting to do things, I'm thinking medical, orthopedic, neurologic. And that is something that folks should know is important, because that's why you would seek out a veterinarian who has specialized in behavior, because we look at these in a very integrated way, and looking at health data, doing a physical exam, evaluating for pain is part of how we work with clients. So yeah, absolutely critically important.
And I found, we're kind of jumping ahead, but that's okay. I found that's perfectly fine. And we're going to get into what exactly is a veterinary behaviorist, but I love this. So one thing, when we talk about analyzing pain, the dog may hide things or may have some aggression issues, fear-based issues, anxiety when they go into the vet. So I can see where it's helpful. A lot of times I recommend that to clients, that they take videos and have videos to share.
Videos are fantastic because you're right. Couple things can happen in a exam room, and as a veterinary behaviorist, our exam rooms are usually bigger, more spacious than an exam room, say, in a general practice might be. So I may have more space, but I still don't see that dog trot up and down a hallway or go up and down stairs. So I might see them jump up or struggle to get up and off the couch, or how they sit in the room can be helpful to me. But videos, if I am not able to appreciate something in the room, videos are really, really helpful, particularly if the family can say, hey, I've been seeing my dog struggle in this environment. And, take a video. Technology is so accessible today, isn't it? Maybe 15 years ago, it couldn't have done that, but really super helpful.
Okay, let's back up a little bit and let's explain to people, what is a veterinary behaviorist?
Well, a veterinary behaviorist is an individual who has started their career out as a licensed veterinarian. So they would have gone through, most veterinarians have a 4-year bachelor's degree. Often in the science areas, they have a 4-year degree from an accredited veterinary medical school. And then most of the time, before they start a residency in behavior, they've already been practicing in a university or practicing in a private practice setting for a number of years. So they come in with a lot of experience as a medically trained or surgically trained veterinarian. Myself, I actually have had multiple career switches. And I started off having done a residency and boarded in surgery and practiced surgery for years, both in academia and in industry, which is how I ended up in Cincinnati. But decided I really wanted to go back into client contact and working with pets, and love training, love behavior. And the residency requires a pretty big commitment. You need a mentor or two. Sometimes folks have 2 mentors who are already diplomates or boarded by the American College of Veterinary Behaviorists. And in that program, it's very well structured to the College of Veterinary Behaviors, that you see cases with your mentor, and then after you've reached a certain point, that mentor has to review every single case you see. So you're getting feedback and red ink on all sorts of stuff and alternative thoughts on how to treat or how to follow up with cases. Over 400 cases we have to see mentored during a residency, which if you're really, really quick at it, you get it done in 3 to 4 years. More people take a little longer than that. You're not only seeing clinical cases, you are rotating, if you haven't done it already, rotating through like a dermatology rotation, internal medicine, radiology, to making sure you're up to date on the latest approaches to treating more advanced medical conditions. You have to structure and conduct and write up and publish a research paper. Many people present it as well at a national meeting. You have case report that has to get published as well. So that's like a really, what you feel is a very representative case that demonstrates your knowledge around diagnostics and treatment of a particular behavioral problem. And then you get to sit the boarding exam. So the first part takes your credentialing, and then there is a 2-day formal boarding exam that you take to be able to say you're a diplomate of the American College of Veterinary Behaviors. So it really is the most, I'm going to say advanced knowledge as far as access to information. The other thing I didn't mention, we cover all species during our residency training. So I had to be tested on birds. I love birds, but I am not in any way an expert on avian medicine. But I had to do zoo animals. I have horses and do some horse work too. So we got horses and production animals. So that's all part of your examination. And a veterinary behaviorist, the reality, I like to think of this in terms of being a veterinary psychiatrist because I think we deal with mental health issues in animals. And I really start using that language with clients just to see how people responded. And I've actually gotten very favorable response to that because we are equivalent to a human psychiatrist because we have a medical degree and we integrate medicine and medical problems in with behavioral problems and the use of medication. and other diagnostic treatments. So anyway, about 100 of us in the world.
Very much of a shortage.
Yeah, I think I'm on the exam committee, and we have probably more, and we definitely have more exam takers this year than ever, which is really exciting. So hopefully we'll see more folks with the certification. Currently, there's not a veterinary behaviorist in every state in the United States, unfortunately, yet.
Yeah, and that makes it tricky then to find somebody.
Makes it tricky sometimes. And then knowing when should you call in or ask for help with, or ask your regular veterinarian for help, or when should, I think, honestly, if I were to look at my practice, probably a half to 2/3 of my referrals come either self-referral or from really good trainers. And another third to maybe half from veterinarians. So the ways people get to us is quite varied, which is different than if you went to seek out a cardiologist, right?
Right. I know I've referred to you. Yeah.
Anyway, that's kind of in a nut. Well, maybe not. Maybe I was a little too long. But
well, you know what? I love that analogy. Yeah, of you and the mental health and the psychiatrist. I think that's great because we really are. We're dealing with mental health issues and some also physiological things that are going on that are impacting behavior. You know, sometimes I go into a case and people just want their dog trained, and you look and you see there's a lot going on here with that dog that we need to address differently. And in order to have some success, we need to address those underlying issues that are going on. And to be clear, then, there's a difference between the veterinary behaviorist and going to see your vet. So you're not replacing the vet. It's a whole
specialty. Yeah, Lisa, it would be, we are in a group of veterinarians, would be in the specialty college under the AVMA, American Veterinary Medical Association, which means that we're individuals who've gone through advanced training in a specific area to become board certified. So it would look very much like if you went to a board certified dermatologist or an internist for diabetes assistant suite. But we work collaboratively with general practicing veterinarians. So I am the stopping point for folks to help solve complex problems with behaviors. They still go to the regular general practice for general practice medical care. I work really closely with the general practice community to help both them identify and treat. I don't have to see every behavior issue, right? There are some that are relatively straightforward that I want them and hope that they do treat, or they can consult with me. I got a lot of folks who will call or text or email me or hey, what do you think about this? Or I've tried this and it's not working. What do you think's next? And the other area that I work very collaboratively with veterinarians is in, we have a lot of pets, cats and dogs, but I probably see more dogs. I'd love to see more cats too for this problem. And that is fear-based behaviors or fear-based aggression in a veterinary office where the pet can't receive care because their anxiety and fear is so high they can't be touched or handled by either the family or the veterinarian staff. So that's sometimes that's the only reason people come to me for is how do I get my pet in the door to be able to be touched and handled and treated. And that causes a lot of anxiety on both sides. What if my pet tore a nail or was hit by a car and I can't get them in because no one can handle it?
So when would somebody reach out to a veterinary behaviorist versus going to their regular vet?
Well, there's a variety of reasons. I think that in one area, it would be sometimes these are referrals. Sometimes the veterinarian will say, hey, I think we've done all we can. You need to see a specialist. Those are great. That might be a case where that veterinarian has tried something already and it's not working. There's been a relapse of behavior. It's gotten more severe. There's a bite, so behaviors have gotten worse. And there's a direct referral or suggestion from the veterinarian. So that's an easy one. So when you feel like you've run out of options with the situation that you're working with, there'll be other options where there are many primary care veterinarians who are not comfortable with or do not want to treat behavioral problems or can't, they don't have time. I'll tell you right off that most veterinary schools either do not have training for veterinarians in the curriculum in veterinary behavior, or it's an elective course. Ohio's great because you got a colleague of mine who's a great behaviorist faculty there. Michigan does not have a veterinary behaviorist faculty, and that's just kind of state by state. So a lot of veterinarians get out into practice and they go, like, I don't understand these medications. I've never been trained to identify a behavior problem. I'm willing to try something, but I'm really uncomfortable about it. So that would be another reason someone should reach out if their veterinarian either doesn't feel comfortable with it or says, I don't do this because it's not what I've been trained to do. And then I see people reach out on their own. I get people who say, I need more help because I'm not making progress, or there was a bite in the home, and I'm the first stop because they get on the internet. And I see a lot of cases that come in through folks like yourself, Lisa, where you're working with a pet and you go like, wow, there's been a bite in the home. There's a lot of fear here. We've been working on aggression toward dogs on leash walks for a year. We're not making progress. They're too explosively angry or upset. There's too much fear associated with loud noises. And we have to have a different evaluation. So if they're coming in from colleagues of mine who are in the training community, it's usually because they don't seem to be able, they've reached a plateau. They can't seem to progress, or the behavior is significant enough. I feel like the really good trainers like yourself know right off. They go, right, well, we're going to work together, but you need to see the behaviorist first. And that's usually if the anxiety, fear, aggression is significant.
Yeah. And there are also times where we get the sense that maybe it's better to have someone with more advanced knowledge about the physiology side of it and how that relates to behavior. And you also have a much more in-depth knowledge about the different medications. And so there's just lots of benefits. So
it's like any specialty, because this is all I do every day.
Right.
So if I'm going to, it'd be probably if you or I went to an internist or a GP and we asked them for help with behavior medication. They do a bazillion things. And I'm so in awe of people who do that because I get the opportunity to focus in one area. And when I get the opportunity to focus in one area, I start to really understand the levers and dials of medication, when it works, when it doesn't work, which to choose, which to not choose. And that's kind of the art, I guess, of practicing. So it's like there's a certain amount of book knowledge you learn when you're boarded, but then there's also knowledge of working with it. So that's another good reason to refer. And as you mentioned, the knowledge of the medications, most veterinarians do not get that training in school at all. So help with understanding which drug to use when, if it's side effects. There's a lot of misinformation about medication out there, Lisa, which makes me sad. When I see a family come in and say, well, we weren't given behavior medication because we were told it increases aggression or it'll cause my dog to go to kidney failure. It's like, that's almost worse than no information in my book.
Yeah. I don't want my dog seeming like he's drugged or...
Oh, that's another one. And neither do I. That's not my goal. I'm not an anesthesiologist. So if you want to see your dog sleep all day, I got to get you to a different specialist. So
I always tell people, you know what? Of all the people that I've referred to back to their veterinarian or veterinary behaviorist and really encourage them when they've had hesitancy about the medication. First, I share my own personal story with my dog and how that's really changed. But I've seen so many times, because I do so many behavior cases, how that can make a humongous difference. And I've never, ever heard anybody say, I should never have done that. What I hear over and over and over again is, why did I not do that sooner? Suddenly now their dog can play, their dog can relax, their dog can just enjoy life. And anxiety can take such big bandwidth in their brain.
We're not good learners when we're anxious all the time, are we? it's helpful to think about a dog's anxiety or cat. It comes that initial panic and fear and rage or anger, because I do think dogs experience all of those. It comes from a very old part of our brain. So we share that. They don't put a lot of the prefrontal cortex like, gee, I'm going to worry about getting in the airplane when I go on my long trip next summer to California. So I'm going to start getting, I don't think that they think that far, but they fear and anxiety and arousal level, that gut feeling is very similar to what we have ourselves, because it's also what keeps us alive. So it's a balance, isn't it? I tell folks, that fear and anxiety is what makes you run fast away from danger, keeps you alive. So that's unfortunately, some animals have a lot more of that. It's more quickly activated.
Yeah, GI issues, or no, we could do a whole thing on the GI issues and how that relates to these issues.
Look at on medical pain. Some of the most painful dogs have been the ones that have bitten the hardest, have been the most aggressive. That sometimes families don't understand how big a role that plays. And I also think sometimes general practice veterinarians, because again, they're not focused in on the behavioral response of the dog, they can underestimate how many dogs are painful and how pain plays out in irritable behavior.
I was just thinking today, I'm a huge pickleball player.
Pickleball?
A huge pickleball player. I had an injury about 4 months ago, and I had a tough time staying off the courts, but it's gotten point I finally got help, and so they're saying, yeah, you need to take time off. But what I was thinking about is that when I was in pain, it really changed my game, because I think you're not even thinking about it, but you're afraid to run for balls because you're afraid of what that pain is going to be like. So you have memory of that. And that's probably going to, even when I heal, that pain memory is going to be with me.
You're the guarded, aren't you?
Yeah. I think about that type of analogy when we're talking about pets too, is if you've got an injury, you're going to be very protected.
That's so true. And not an area we're talking about today, but that's a huge, huge area for horses. Because riding and saddle fitting and bridles and shoeing, if, the orthopedic problems that, but, any animal that uses themselves athletically going to even be harder. I think I have actually seen a number of dogs who are performance dogs, agility, tracking, and these families, owners, are really attuned to how their dog is working many times. Whereas maybe a family pet might get missed for a while, but they're noticing, they missed that jump a little bit, or they're not quite right on the leaf poles. And I think that pain comes into noise and sound sensitivity, gets amplified, and there's a lot of subtlety to this, like you described, right? That may just start by a drop in performance, slowing a time, slowing a willingness to do something. I encourage folks listening to us today to think about that and make sure that they're asking their veterinarian to look at medical and pain-related or orthopedic or neurologic pain-related problems. We could just spend a whole hour talking about some of the cases I've seen.
And I would love to do that. Yeah. And even the GI stuff, that's kind of a hot issue for me right now. So definitely would love to have you back and have another discussion for people. That would be great. Well, I so much appreciate you being here today.
Oh, it's been a delight, Lisa. Thanks for having me.
Sure. So we're going to have your information and how people can connect with you in the show notes. So we really appreciate that.
I am always happy to, answer emails. I practice primarily in the state of Michigan, Detroit area, Grand Rapids, and Traverse City, but I do see cases also in Northern Ohio, and I consult with clients and their referring veterinarians across the United States and in Canada. So that way I usually work with the local veterinarian, but I see client cases all over. So please if folks have questions, or I can put you in touch with another veterinary behaviorist in their area too.
Thanks for listening. If you enjoyed this episode, please consider subscribing to my podcast. Come back often and tell your friends. If I can be of any help to you and your pet, please reach out to me via my website, www.somuchpotential.com. And for a lot more information, fun, and videos, please follow me, So Much Potential, on Facebook, Instagram, and YouTube. See you soon.